1 in 33 babies are born with a birth defect in the U.S. every year, and that's according to the CDC.
While many go on to have healthy lives, birth defects are still the leading cause of infant deaths in the country.
In today's Your Health Minute, Mandy Gaither has the steps to reduce the risk.
13 years ago, when Amy DeSantis gave birth to twins, she had no idea one of them had Down syndrome and a heart defect.
It's overwhelming. There's a lot of fear, a fear of the unknown, a fear of what the future will look like. Will this child have a future?
Some birth defects are preventable, others are not, but experts say early intervention is critically important. The infant and maternal health nonprofit March of Dimes says most birth defects happen within the first trimester, but can happen later in pregnancy too.
A lot of women have no idea what their risk is or anything about birth defects.
The organization says taking 400 micrograms of folic acid before and during early pregnancy can help lower the risk, as can seeing a healthcare provider at the beginning of pregnancy, where medications and medical history can be reviewed, and avoid drugs, smoking, and alcohol while pregnant.
The number one cause of preventable birth defects is alcohol. And researchers did a study that showed almost 1 in 7 pregnant people is drinking alcohol today.
DeSantis's twins just turned 13, and despite his challenges, her son is thriving.
He does everything that his sister does and then some. So he's living a wonderful life, and he's a happy guy.
For Health Minute, I'm Mandy Gaither.
The March of Dimes says things that can put you at a higher risk of having a baby with birth defects include certain health conditions like diabetes, taking certain medications, and age.
Approval for an experimental treatment for Alzheimer's disease is now on hold. The U.S. Food and Drug Administration declined to grant accelerated approval for donanemab and is requesting additional data from the drug maker Eli Lilly. According to the Alzheimer's Association, phase 2 trials showed significant slowing of decline in memory, thinking, and daily function. Eli Lilly plans to file phase 3 clinical trial data later this year.
Today marks 3 years since the first COVID-19 case was officially confirmed in the U.S. It was diagnosed in Washington on January 20th, 2020. The patient had recently returned from Wuhan, China, where the virus first appeared in 2019. Studies later found evidence the virus was in the U.S. weeks before the first case was officially confirmed. Since then, 102 million cases have been reported in the U.S.
A new study on concussions in children finds rest isn't always the best medicine. The study found that allowing kids to get back to their normal routines a few days after a concussion produced a better outcome in their recovery. Researchers followed more than 1,500 children in Canada, ages 5 to 18, with concussions. Kids age 8 and up who returned to school 1 or 2 days after their injury experienced fewer symptoms at 10 days post-injury.
Emergency departments are cutting back on opioid prescriptions. That's according to a report from the Centers for Disease Control and Prevention. Opioid prescriptions given in emergency departments dropped to 8% between 2019 and 2020. That's down from 12% between 2017 and 2018. Studies show people who receive opioid prescriptions at ER visits are at risk for developing long-term use and even overdosing.